Okay, so let's take a look at the last of the emergency procedures before we move on to just the few things you need to know about physical therapy and lifting and other. So this is the end lecture for this. So let's talk vascular accident, a CVA, commonly known as a stroke. So I believe that is what you have to put it in as, but a cerebral vascular accident. So there's two real causes. One is that a blood vessel just ruptures and starts bleeding excessively in the vein inside the brain. And then the second is that you actually get a clot in the blood vessel. And really, just from an external perspective, you do not want to take a guess at which one it is, whether it's a blood vessel that's burst or if it's one that's got a clot in the artery leading up to the brain. Either way, you're going to see the same sort of symptoms. So numbness in the face, arms, legs, loss of vision, and this is all one-sided. So you're going to see drooping of the face on one side, inability to move the body on one side. So if you ask them to smile, stick out their tongue, lift both arms, they can't walk with both legs, one side of the body is being affected, right? That is your sign that this is occurring. So let's take a look at a quick picture. Okay, so we often use the acronym FAST. So we look for the face, right? Is one side not moving and it's totally drooping? They can't smile. Arms, one arm is weak, slurred speech. And the T actually stands for time. Really, your best bet here is to call 911. You have about 2 hours or so before we see some irreversible damage and we're no longer able to give certain types of medications that might improve their outcomes. So acting quickly is your best friend here. And so recognition and acting quickly, and I know that seems obvious, but I have known several people, seen several people that did not recognize the signs of a stroke, right? It has gone on for several hours and it's created some additional long-term damage in terms of being able to recover from that stroke. Again, 911, 911, 911. Just monitor the vitals, keep the airway open. Don't give them anything by mouth, right? They are unable to control muscles on half of their body. But the faster we get care, the better here, right? It's your only real option in terms of treating a CVA. Next up, we've got a heart attack. Its official term is a myocardial infarction, abbreviated as the capital letters MI. So what happens is that the arteries around the heart become blocked. There are four main arteries, and so any of them, all of them can be blocked. Your traditional symptoms are the stuff you've been trained to sort of look for. Pain in the chest, radiating down into the left arm, the shoulder, the jaw. That is your typical male symptoms. For women, what they often see are a little bit different. So tightness in the chest is still very common, but they often get shortness of breath as their biggest symptoms. So it feels like they really just can't breathe. It's repeated. There's no other reason like asthma or some other trigger, but chest pain, chest tightness with difficulty breathing is certainly something you want to look for. The other thing that they often see is something called diaphoresis, which is just super excessive sweating. The body is working so hard to get oxygen to the heart muscle itself, and the heart muscle is dying, and so it's not being effective for everything else. So just be a little bit aware that in women, it often doesn't get recognized the same as in men. Where they have that typical radiating down into the arm, whereas women tend to stay right in the chest area. So consider a heart attack, right? If there's a lot of pain in the chest for no other reason. So here, 911, 911 immediately, right? Don't pass go. Get the patient to relax and be comfortable. The less work the heart has to do by being panicked and moving around, the better. Do give some aspirin. Most of us have aspirin, or you should have some pill form of aspirin. It can just be the baby milligram version. Doesn't have to be high, but whatever you've got, have them either place it underneath the tongue so it starts to dissolve and get into the bloodstream immediately. It'll taste gross, but it is what it is. Or chew it and swallow it because it will digest and absorb. And aspirin is a blood thinner. This is the one thing that is proven in terms of first aid that you can do to immediately help them, right, from a strict first aid. The rest is just to wait to see if, right, their heart stops. Do I need to do CPR? Do I need to use that AED that we talked about last week? So, right, consider if it goes forward. Again, if the patient stops breathing, if their heartbeat stops, you are going to be giving CPR. I have put a link into the stuff we talked about last week for the steps of CPR. It is a course you have to fully certify on next semester. So for this class and in terms of the final exam, I'm not testing on any steps of CPR. Just know that for the project, you can list them out and find them on a website, and that you just know that if their heart stops or breathing stops, you are giving CPR. Rescue breathing is where their heartbeat is still going, but they are not breathing. We used to call this mouth to mouth. Again, I'm not going to test any of the particular steps of this. It is just meant to keep oxygen going into the victim's body while we're waiting for EMS. Rescue breathing alone is not going to bring a patient back. I will not ask any particular set of steps on any of the final exam questions. Again, just be familiar with CPR, AED, what they stand for. Just so you're aware, the earlier you recognize and start, so this is the last bullet point, you're going to double or triple your victim's chance of survival. All right, last but not least is the part that I included in your project. And you had watched a little bit of some videos when it came to burnout and then some emergency procedures. I had linked a whole bunch of CDC sites, and you did answer the questions wonderfully. However, so mass disasters do happen. You guys will be healthcare professionals. You are on the front end, right, of a healthcare emergency. And so just keeping in mind that you are then, once you're an MA or in healthcare, you are considered, right, vital emergency personnel. So you may have to deal with some of these things. So just having some general idea of what to do in the case of a mass emergency is super important. So you are expected to assist local shelters, provide first aid, CPR, helping at clinicals or hospitals. You will be trained to give injections or mass immunizations. Even in New York State, there have been a few situations where it is such a mass emergency that those things would be lifted. You are trained to do it, and you are allowed to in other states. New York State, California don't allow it at the current moment, although it's on the table in the state legislature right now, but that would be lifted in the event of an emergency. So please pay attention, giving all your support, other emotional support. So making sure that you respond appropriately is key. So the one last thing I want to go over is our tagging and response system, just so you're familiar with the 3 levels of tagging in a mass emergency. All right, so this is the tag you're going to use at a hospital or facility. If you are in an absolute mass casualty situation. So you can see this is just both sides. This would be a single tag that would get placed around the patient, somewhere on their body. So what happens is you can record down the patient's name, address if they're conscious. You can list vital signs, right, that you've taken or other things that you see. And really at the bottom, you're looking at 3 things, and it's a little bit sometimes against natural inclination. So number 1, these things tear off, right? So the white would tear off, the green would tear off, right? The yellow would tear off separately, the red. So if they're deceased, you're just going to tear everything off to the red, and you'll just leave it as the black tag. We have 0 priority on them. Next are things that are immediate injuries. So without surgery or other major medical attention, they will then get next priority. If there are things like fractures, even if they're significant fractures, right, but their vitals remain stable, they would be considered things like delayed, right? So there's no vital signs majorly affected. And then we've got minor injuries. So closed fracture, strains, sprains, other, they're going to receive priority 3. And then if they were involved, but you're not really even seeing any injuries to be dealt with, they're priority 4. Right? I mean, so they don't really have any injuries that may ultimately kill them. So they are considered a priority 4. So that is our tagging system for mass emergency situations that you should be aware of.